we've got some important information this morning about healthcare coverage. The open enrollment period for healthcare.gov has extended into January. And today, Mike Bertaut, a healthcare economist and Straight Talk blog author, is here to talk about the extension, who is eligible, and how they can sign up. Welcome back to the show, Mike.
Thank you. Thank you, Malik, so much for having me. And it's just a joy to be with your viewers today.
Glad you are here as well. And I'm glad to hear that the healthcare coverage enrollment period has extended. What can you tell us about why it's been extended and what's going on now?
Sure. Well, we're rapidly approaching the end of the original open enrollment period for healthcare.gov, which actually ends originally on December 15th. Now, if you want a plan that is in effect on January 1st, you've got to make sure you pull the trigger there by the 15th of December. But if you miss that window, you'll have a whole nother month of open enrollment between December 15th and January 15th, where you can gain coverage, no questions asked, really. And that coverage will begin on February 1st. So if you need that January 1 date, you want to make sure you select a plan by December 15th.
And notice at your calendars, everyone, that's a couple of days away, really only 2 days. So make sure if you haven't signed up and you want coverage by January 1, make sure you sign up. And why has it been extended? Is there a particular reason why?
Well, we're still under technically what's called a presidential health emergency, which is all COVID driven naturally. And that also has led us to the situation where there's a lot more financial aid available on healthcare.gov now than there was in the pre-COVID days. That's part of the American Rescue Plan passed way back in March. This gives Louisianians an opportunity to buy insurance at much higher incomes than in the past for a much lower premium. So we want to make sure people are taking advantage of that. Of course, they don't have to go it alone. We have licensed, experienced agents in the market who operate without charging you a nickel, right? And you can get connected with one of them by using getplanoptions.com or 1-844-GET-BLUE.
Some great information there. We actually have a visual we want to show you all so you all can write that down, 1-844-568-1417 or getplanoptions.com. You're seeing it on your screen right there. But Mike, while I have you here, I'm curious, what kind of things should people keep in mind when looking at these healthcare plans?
Well, it's very important. There are more options available on healthcare.gov than really we've ever had before, specifically there for people who don't get a decent offer of coverage at work or who don't have other options. And it's really important that you understand two things. Number one, the higher metal level you buy, the higher your premiums will be, but the better coverage you'll get. So we have bronze plans, silver plans, and gold plans. As you might imagine, gold costs more than bronze, but the deductibles are lower and the copays are lower. Second, even more important, make absolutely sure your doctors and your hospitals are covered on any plan you select. For the first time, we have some plans on the market that have relatively narrow networks, cover fewer doctors, and we want to make sure that people don't end up buying a plan that doesn't allow them to see the medical providers they care about.
And we all know that healthcare coverage is important because we are still in the middle of a pandemic right now. How has that been affecting healthcare insurance costs, if at all?
Well, you may remember during 2020, a lot of hospitals were so overwhelmed with COVID patients that they literally stopped doing other procedures that they normally would have done. Now, the people who didn't get those procedures in 2020 all showed back up in the spring and the summer of 21, and that drove a lot of healthcare spending. The second thing is the Delta wave brought a lot of people into the hospital, unfortunately, who were much younger than in 2020. The average age in the hospital in 2020 was about 70 years old. In the Delta wave in August, it was closer to 50 years old. This means that Blue Cross was paying for a lot more hospital stays than we would have normally. You're going to see both of those things reflected in your health insurance costs in 2022. And honestly, the best way to avoid that cost is simple. It's vaccination. The more people that get vaccinated, the fewer people that are vulnerable to those expensive hospital stays from COVID.
And speaking of vaccinations, Blue Cross and Blue Shield of Louisiana actually has a really cool promotion going on right now. You all have partnered with somebody locally to help get people vaccinated or their booster shot. What can you tell us?
Well, remember, your booster shots and your original shots are all free, right? The federal government pays for the medications, and then your insurance company or Medicaid or Medicare will cover the costs of the actual shots. What we did was we're trying to eliminate all the barriers to people getting vaccinated. So if transportation's a barrier, we're partnering with the Blue Crew and using our Blue Bikes program in a program we call Riding Toward Immunity. The way it works is these are promo codes you're seeing on the screen now. The first promo code on the website will get you a free 30-minute bike ride to get you to the place you're going to have your shot. The second promo code will get you another free 30-minute bike ride so you can get back home, all designed to support immunity through the Blue Bikes program.
And it's great that you all are doing that. Thank you so much for being here, Mike, as always. And hey, if you want to learn more about this promotion, it's called the Riding Towards Immunity Promotion. You can head over to bluebikesnola.com or find them on social media at bluebikesnola. And for more information about open enrollment, you can log on to straighttalkla.com or getplanoptions.com. You can also give them a call at 1-844-GET-BLUE or follow them on social media at BCBS LA. Stick with us, everyone. We'll be right back.